Well, let's start doing eyeshadow today, and how we're going to do that is simply to, first of all, dip a fine tip makeup brush into our pigment and draw it on the eyelid. The reason you draw it on the eyelid first before you start is so that you get your borders and you're also training your brain. I just picked up the Squirrel needle to test this woman's skin because it's very stretchy. She has no collagen. She's in her 70s, and I want to see how I'm going to do. And it's always challenging, especially when their eyes are this deep set. Now, once I've opened the skin and the skin is broken, I add a sort of a cocktail. I mix either Ultra Duration with Tag or Ultra Duration with Numb Quick Pink and put it over that area. Bruising is good on the eyelid, but bleeding is not so good. The skin is very thin. You can see the bruising there, but that's okay. Now let's go to the second eye where the first eye starts letting the medication take effect. And let's just paint on and train our brain with the second eyelid. Start about a 45-degree angle upward from the outer lash, and then shape it down toward, so it tapers down toward the nose. And that may be a big much, but it's really not. She's got very thin skin, and you won't even see it unless it's thick. Here I've switched to the 5-slope needle in the Nouveau Contour digital handpiece. My needles are barely out there, I kid you not. The eyelid is such thin skin, you are going to see what we call punctate or pinpoint bleeding. You're also going to see a lot of bruising. That's fine. Just not too much bleeding, because then you're too deep and you're going to be putting color in the muscle where you will not be able to see it. Now, effective topicals allow the client to lie still, and then you can apply the firm, even pressure that's needed on this flabby skin. See how nice this first side is now when I go back? The topical anesthetic has taken effect. The bruising, the swelling has gone down, and I can now give her a more desirable, glamorous shape. Start at the top and work down. If you start at the bottom and work up, because of swelling, you're going to have a false sense of how thick you're going. Firm, even pressure is the key. Firm, even pressure. You notice I'm not working nearly so hard on this second side now. I'm able to brush in the color with the 5-slope needle. That little bleeding you see up near my top thumb is good. That's okay. The skin's very delicate, very thin, and you can see I'm going over that. We are working on a living canvas. They are going to have a little bruising and bleeding. What you don't want is a lot of bleeding, because that means you're too deep and you're in the venous plexus is what we call it, which is below the dermis. I'm cleaning the eyelid with Numpot ointment. This is very important because it's very soothing to them. So we're starting to get some color in here. You can see that. Now, it's not easy. Sometimes you have to be patient. This is not, you're more like the tortoise than the hare, but you will get nice color. One of the secrets of success is trying to not overwork the tissue and getting more and more selective as you work, so you don't just keep overworking, making 1, 2, 5, 10 passes. Be selective, feel the tissue as you clean with Numpot. Just see what's remaining. You can see she is starting to get a nice even color on her left upper eyelid, and you can see that the swelling and bleeding have been pretty well controlled. Here we are. We're now on the right upper eyelid. You can see I'm painting over that bruising, but the topical anesthetic, ultra duration, and tag mixed together, or ultra duration and numb quick pink mixed together, has gotten the eyelid swelling under control. It's also made the eyelid easier to work on because the skin seems to be less flabby, what we call flaccid, floppy. You just have to be patient. I'll tell you, this gal is a real challenge, but she's just wonderful. She wants this smoky eyeliner. We're using the pigment Smoke. We're also using Silver Mist. We're going to be using Silver Mist a little bit. And then on her touch-up when she comes back, we will use more Silver Mist so that we have sort of a tri-shadow effect. Again, I'm painting it where it needs to go. This is really training my brain. It's also putting color on the skin that the needles can carry into the skin. So there's less likelihood of working with dry needles. See how this is hard for me to work on her. I'm working from the top down, trying different angles of approach with the 5-slope needle and the digital machine to get a nice result. Now that I'm finished, you're going to see that I've put a coat of pigment on her left eyelid. Now I'm applying it to her right eyelid. During her cool down period, I keep an extra coat of pigment over the area where I've worked so it absorbs as much color as possible. Aloha and thank you.